the Resident and President-elect of Medical Women Association of Nigeria Delta State Chapter. I'd like to warmly welcome to the studios Dr. Ngozi Nzekwe. Very good morning to you.
Good morning, madams.
It's a pleasure to have you.
Dr. Agogo Akpe, good morning to you as well.
Good morning.
It's a pleasure.
Thank you.
All right, February 4th every year is World Cancer Day. But of course, we do know that there are different types of cancers now. But I think there's a general principle. But what exactly is it? We want to be enlightened this morning by this experts who will be sharing their views with us. So if you're taking a look at the World Cancer Day, theme for this year, predisposing factors, and what we can do to prevent or to manage. So once again, a very good morning and welcome.
Thank you.
Okay, let's begin by taking a look at the theme for this year, World Cancer Day. I am responsible, I am accountable. How do you factor this into the celebration of a World Cancer Day?
Thank you. The theme of this year's World Cancer Day, as you rightly said, is I am and I will.
I will.
I am responsible means I'm responsible enough to take action as regards my health. We find out that many times, generally, people are careless and about things concerning their health. Yes. They notice symptoms and the first thing they do, they want to ask their neighbor or sometimes even Google. They want to find out, oh, I have this, what, you know. But when you take responsibility, you want to observe your body, study your body, notice the changes and find out what could be going wrong. Another way to take responsibility is to look out for one another. And that is what we, as a body, Medical Women Association of Nigeria, stand for. We want to look out for people, we want to bring in, especially those who are not in the medical profession. We want to let them know that these are the things you should look out for. If you see anything like this, let us know so that we can come in and help you.
Okay, what about the other aspect of being accountable? How will you speak to that?
Being accountable means that when you notice something, you find out, you let people know and let people know what is going on.
Okay.
You understand? For us now, we are doing free cervical cancer screening.
Okay.
That is a form of accountability because we owe it to the populace.
Okay.
We owe it to them that we are not just talking, check yourself, and doing nothing about it. We are taking a step by being responsible and being accountable.
Okay, Madam, I want to take you on this one. My colleague actually started off with different types of, cancer.
Cancers.
And I know that cervical cancer is more or less like a thief. Because sometimes you don't really know you have it except you go for a check. It's just like you have glaucoma. Now, what other areas do you think women should look into in terms of cancer?
Okay, thank you. First of all, let's give a general overview of what cancer is.
Okay.
Now, cancers, we have normal cells, but for some particular reasons, some genetic mutations and some exposure to risk factors, the normal body cells begin to overgrow. They just grow without limit.
Okay.
And then by the time they start to grow without limit, that is when we call it a cancer. So you can imagine my hand, this is the normal size, and all of a sudden it grows as large as an elephant, you know. So that is what is cancer. Now, for women, we have cervical cancers. The womb, the balloon, it is like the balloon, the balloon where the baby is carried.
Yeah.
The neck of it is where what we call the cervix. Okay. And that is where cervical cancer comes in. And so it's deep inside the body. And most times the first signs that a woman will know or see that she has, that will give a suspicion of cancer, is either a foul-smelling discharge or unprovoked vaginal bleeding. At that stage, it is already late. Okay. Even for a medical professional to intervene, so that's why we are hammering now on screening. Screening is to pick it early. We go there, we look inside the cervix of the woman. It has to be an active process where you must take responsibility to come and let us look at it and see if there are any signs of abnormal cells growing. Because if we wait till when your body gives you a sign, then it's already too late. Okay. So cervical cancers are one of the things. Another cancer that plagues women or girls is breast cancer.
Okay.
Yeah, breast cancer, and that one too. It's easily early detection is a key, And one thing you can do is self-breast examination, monthly self-breast examinations. I would prescribe, once you finish your menstruation, do your self-breast examination. So it's a monthly thing. The fact that you don't see a lump today doesn't mean that a lump cannot develop within the next 1 month. So monthly. But there are also investigations you can do. We talk about mammography.
Okay.
Mammography is an X-ray of the breast. So we project X-ray, it visualizes the internal tissues of the breast, and it can pick up a cell, a cancer cell, 3 years before you feel a lump.
Okay.
Yeah, so sometimes that's the accountability. Sometimes we say, oh, we don't have the money. But on the long run, it is cheaper to do these screening investigations than to treat cancer. Because a treatment of cancers, we're talking about surgeries, either a breast mastectomy or removal of the whole womb, which we call a hysterectomy. And it doesn't end there. We have to do chemotherapy, take a lot of drugs, and other ancillary medications. By the time you finish with that, we are talking about millions. And let's look at it. How many Nigerians can actually afford to treat it? And if you really have seen a cancer patient, you will know. When you see the suffering the patient is going through, you will know that prevention is far cheaper than any form of therapy.
Okay. Thank you very much. Sometimes when we hear those things, they seem alarming. Okay, but good enough, you are here to enlighten us so that we can do the right things at the right time, not when it is already too late. Let's take a look at some of the risk factors when it has to do with these cancers that you have mentioned. What are the things that are predisposed, that could predispose the individual to these cancers?
Okay, thank you. Some of the risk factors are, for instance, for breast and cervical cancers, the major risk factor is being a woman. Yeah. And then, yes, for being a woman, you are more predisposed. Not like men don't have breast cancer, but females generally, the sex is a risk factor. Then age. The older you grow, the tendency is for the cells to, misbehave and from one insult or the other to become abnormal. So age, increasing age. But I must say that we're beginning to see breast cancers, cervical cancers, even in the younger age group. And that is one of the reasons why we're making noise. Then also genetic factors. Genes means things that you inherit from your parents, your grandparents, and that is closely related to a family history. If someone's mother, grandmother, aunt, close female family relative has suffered from breast or cervical cancer, you want to be extra vigilant. The same goes for the prostate cancer. I don't want us to leave the men alone. The prostate cancer is the commonest form of cancers in male, and we're also trying to beam our searchlight on that. So we've talked of sex, age, family history, and then some health, some of the activities that we carry on. Smoking, alcohol.
As a lifestyle.
Yes, lifestyles. So when you take alcohol, you increase your risk of developing cancers. In fact, I always tell people, because people may argue, but I tell them that the benefits, the risk of taking alcohol is far, far worse than the benefit. So it's better you stay off as much as possible. And then when you even smoke, in addition to taking alcohol, the risk of developing cancer multiples, in fact, more than doubles.
So are you saying that one should not take alcohol at all, or you just do a little bit of it? Is that what you're saying? Why is the wine? Moderation. And start saying, oh, we had her, she said, don't take it at all.
Well, moderation is key. Like I said earlier, when you want to look at the benefits versus the risks, and you make a decision.
That's true.
And then if
and
you
your body mechanism as well, how you react to alcohol.
Exactly. So, and then with a family history, there are some things that when you think of where you're coming from, you may need to avoid certain things, not necessarily because they are wrong, but if, for instance, your mother had cancer, you will not be more careful. So, smoking and then obesity. We want to encourage people to exercise as well. All that helps, because when you exercise, you give the cells more oxygen, and this helps to prevent all those let me use, for lack of a better word, let me simplify it, all those chemicals and agents that can cause, all those toxins that can cause cancer. So they help to push them out of the system.
Wow, that's
While you were talking earlier, Dr. Akpe, you mentioned something about screening, vaginal screening, and you mentioned also the mammogram.
Yeah.
Now, how often should women do this? And for the men, what kind of screening should they do to find out whether or not they are likely to have a cancer, prostate cancer, in their own case?
Okay. So for breast cancer, I talked about self-breast examination, which is being displayed on the screen now. That is a monthly thing.
Okay.
But if you're going to do a mammogram, then you do every 2 years, every 3 years. Every 3 years.
Is it very expensive?
Well,
It's moderate. It's moderate. It's affordable.
Well, you see,
We could say it's
expensive,
But it's affordable.
It's affordable, and it's cheaper in the long run.
Okay.
A decent mammogram should be between 10 to 15,000 naira.
Can it be done in the state capital, for instance?
Yes.
What
Many
hospital?
centers. Many centers.
Okay.
I think the Asaba Specialist Hospital can do that. We have a mammogram,
Okay.
and many other centers, FMC, and all that. You know, so you need to take responsibility. Go for those tests. So that's self-breast examination, mammogram.
Sorry to cut in that.
I just wanted to let people know
Okay.
that courtesy of the Medical Women Association, we've actually gone the extra mile of negotiating with certain places in the state to do the mammogram at highly subsidized rates.
Okay.
Sorry.
So we'd like to have the list of those places.
Yes.
Because the goal of this is for citizens to be enlightened, and then we can safeguard their health and their lives by extension. All right, still on the subject of screening.
Of screening.
Right.
Then for the cervical cancers, there's what we call the visual inspection. Okay, that is, you come and then we look in and just see what is happening there. We can tell if it is normal or not. That is advised every year.
Okay.
Yeah, but if we now go, after looking, we take a sample, we call it a pap smear, and send it to the pathologist who will look at the cells and say, oh, this one is abnormal or is normal.
Okay.
That one is done every 3 years in the first instance. But as you grow older and you keep getting negative results, we can now increase it to every 5 years. Yeah. But for the men, what we do is prostatic specific antigen, PSA screening. Okay, so it's just a blood sample, it's run in the lab, and then they take the levels of the antigen in the body. It shouldn't be more than 4 micrograms. So when you have levels above that, you know, it raises the suspicion, and then you can go for further evaluation. That also should be done frequently, yearly, and then as you get negative results, we increase it to 3 yearly.
Okay, well that's, do you know, at the point you were talking, you mentioned blood, unusual flow of blood from the vagina, and you said that could be a symptom of cervical cancer.
Yeah.
Well, we really do not know if we have all symptoms. My good, that we have symptoms, you know, associated with cervical cancer. Do we have symptoms besides that? It's just, do we have symptoms, or it's just like the glaucoma that does not have?
No. There are symptoms.
Okay, what symptoms?
So like I said, vaginal discharge, foul smelling, most commonly foul smelling vaginal discharge, unprovoked vaginal bleeding. That means it's not your period and you just see bleeding. Or for women that are postmenopausal, they now have bleeding all of a sudden. You've attained menopause for some years, and then all of a sudden you start bleeding again. And then post-coital, coitus means sexual intercourse. You have sexual intercourse and then you start to bleed. That should not be. So those are some of the symptoms. But sometimes for some women, some symptoms can be, yes, for some women we won't have all that, but the cancer is beginning to spread. You know, the uterus is near the waist. So you have waist pain, back pain, some can just develop paralysis, and by the time we start to investigate,
I think waist pain at times could be as a result of age as well.
Yes,
we actually know that they have symptoms that are similar.
Yeah, that's why I said you go for investigation, for screening investigation, and then the doctor can tell you what is causing this thing. Then sudden weight loss.
Okay.
Yes, I saw a patient about 2 months ago, a very sad one, a 65-year-old grandma, and all of a sudden she started emaciating. Then she went through all the tests until they did an ultrasound scan, and then even the ultrasound scan was okay, but after that scan, she now developed the bleeding, and that was what prompted us to now investigate and found out that she had a stage 3 cervical cancer, which is already advanced.
Okay, now on the 4th of February, we do know it's
World
Cancer Day. Now, what you're doing at the moment, what, let's look at your beats and your activities. What activities do you have lined up? Is it to mark the day?
Thank you. On tomorrow, which is the 4th, we'll be in Ogara, in Saple, number 47 Ope Road, the Anglican Church there. Okay. We are going to be doing free breast and cervical cancer screening.
Okay.
On the 6th of February, Saturday, we'll be in Anyoma Hospital, Agbo, to offer the same service. On the 7th, which is a Sunday, because some of our members reside in Benin, we'll be going to St. John Vianney Catholic Church off Saple Road, Benin City, for the free cervical cancer screening. On the 13th, we'll be in the Baptist Church in Warri. We can communicate the details. On the 20th, we'll be at the Redeemed Christian Church of God, Ogara, for the free cervical cancer screening. And we are open to invitations. We are ready to collaborate.
Is there any
Yes. We are going to be, it's still, the month is fairly new, so we are still on it. But at the World Health Center, we are planning one as well.
What center?
Umagu Primary Health Care Center, the one opposite the stadium.
Then the national body is already running free cervical cancer screening in the state secretariat clinic.
Okay.
Yes. So you just walk in there and then you.
So throughout this month,
the
state secretariat clinic on DBS Road, off DBS Road, off Jesus Save. Sorry, off Jesus Save.
So you can just walk in there and
today it's more.
Yes, yes, please. Yes.
From now to
we'll still be having a major one at the Primary Healthcare Center.
Okay.
Where did you say the state secretariat clinic is?
Off Jesus Saves Road.
So any woman can walk in there.
Yes, please. We encourage every woman to take responsibility.
What's the test like? Is it an
visual inspection of the cervix?
Let me explain. First of all, some of the precautions are, we would advise that you abstain from sexual intercourse 2 days before the test, and then you are not menstruating.
Okay.
Yes. So when the woman goes, we will explain to her what we want to do. It's a test that takes less than 10 minutes, 5 to 10 minutes. It's not painful. It's not painful.
Okay.
We would look, stain the cervix, inspect for any abnormalities. If there's any need for it, we'll do what we call a pap smear, like she explained.
Okay.
And the results will be made available to the woman.
So let's say the result is positive. What do you advise? What should that lady do at the moment?
Usually we don't let such ladies go. We usually, as much as possible, work hand in hand with them. We have our colleagues in the Federal Medical Center and the specialist hospitals across the state. We link them up and we try and start a process. In fact, presently, Medical Women Association of Nigeria, with help from National, has been able to sponsor treatment of 2 patients with breast cancer. We were able to link up with the general surgeons at FMC, take what we call a biopsy, that is to determine the exact kind of cancer. Wow. We paid for her drugs, and so far so good. She's had her 3rd or 4th course of chemotherapy now, and she's doing well. So we won't let you go. We will work with you as far as you would let us go.
Okay.
Yes.
There are those who have a fear, who will wrap this up in a moment, who have fears that sometimes it may be okay. It is when the tests have been done, okay, that they now started manifesting. Like the case of the woman that you said she was perfect, she was emaciating, and then when she has been examined, that was now the symptoms now started showing. She wasn't those fears.
No, she wasn't.
It was not perfect. She was emaciating.
Okay. So we needed to look for the root cause of what was causing that problem.
Then I'd say symptom is unique to someone. It's not the same. What's happening to her might be different for another.
From the symptom of another person.
Yes, of another person.
Symptoms can be different.
And then when we talk of weight loss, think, unplanned weight loss, especially more than 10% of your body weight. You will find a lot of women want to lose weight. Don't we all want to lose weight? But when the person is not, you're still eating as normal, everything is going on as normal, and then you're losing weight, or even a reduction in appetite. So these are things, and that is why we must make this screening test as frequently as possible, so that you pick. Yes, people have that fear that the thing is just there, is on its own. Once you touch it, it will not erupt. People are afraid of the unknown. But either way, it's always safer. It's safer. Ignorance is no more bliss.
I appreciate you for coming.
And actually, the prevalence in developed countries, the prevalence of these cancers are on the decline because they have taken prevention and routine screening, annual screening very seriously, unlike us in the underdeveloped world. So that's why Medical Women is pushing for preventive measures to see if we can actually drive down the prevalence of cancers. And also for prevention, there's vaccination against cervical cancers. Yes, because one of the pathogens implicated is the human papilloma virus, and there's a vaccine for that. And we advocate that children, both boys and girls, between 9 to 25 years, as long as they have not been sexually exposed, should have that vaccine, 2 doses.
So if you're sexually exposed, you don't.
Yeah, because the risk
been exposed to the virus.
The virus is sexually transmitted.
If you go for the test and you don't have it, can't you take the vaccine?
Yes, you can. Yes, you can. A 35-year-old, as long as we've done that.
All right, thank you very much. We'll let it rest here.
Thank you.
We appreciate your coming here to enlighten us today. Now, I would like to take final message from both of you as we cap this.
Okay, so Medical Women Association of Nigeria Delta State is encouraging us to take responsibility for our health. Avail yourself of the opportunities, even if you have to pay for it. The cost of prevention is better than cure. Thank you.
All right, thank you very much. Coming up next is Thinking Beyond the Box, and of course we have Gabriel.
We should have that. That's in a moment. So again, we'd like to say thank you to Dr. Ngozi Nzekwe and Dr. Agogo Akpe, Resident and President-elect, Medical Women Association of Nigeria, Delta State, for coming here to really enlighten us this morning, safeguard our health and safeguarding our lives. I appreciate you.
Thank you.
Okay, thank you. Once in a moment, please stay with us.